There's not a day that passes that Cassandra Josey does not think of her son.
He was 17, so we're just gonna fill a car, we're gonna joyride. And
She says that mistake cost him his freedom.
I felt robbed, I felt ashamed, and I thought, like, not my child.
It also cost her peace of mind.
Of not being able to talk to him, or you only get one, minute or two, and you can hear the distress in his voice.
Her story is one like many moms and other Black women across America who have sons or other loved ones incarcerated.
He got into some trouble and he was sentenced to 15 years in prison on a first offense aggravated assault charge.
Tiffany Smith agonizes over her son's well-being as well. Both women are choosing not to share their sons' names for safety concerns.
I'm hoping that we get an opportunity to have his case looked at again.
This stress is constant. A reason Emory University spearheaded a study to see how one's incarceration can impact a family member's health.
As we age, biologically, our arteries naturally deteriorate.
Dr. Nicole Fields decided to research the heart and determine if this constant stress is accelerating heart disease among Black women living in Metro Atlanta with children behind bars.
I'm really interested in looking at structural factors and how they influence heart disease, diabetes, for example, of Black women in particular.
Out of the study group, nearly half had loved ones who were locked up. What they found was startling.
Women who did have a loved one incarcerated had a higher blood pressure in the aorta.
This gave Tiffany Smith a new outlook on her life.
Although I'm not consciously aware of it, just, really taking into consideration how this is really impacting my body.
It affected my physical being, and I didn't relate it to that until then. I had to look at the timeline. I was like, wow, I started to have health problems.
The concern is that higher blood pressure could lead to cardiovascular disease.
We do need more research to really understand, is it incarceration that leads to changes in these measures for heart disease? But I think it's important that we're looking at a societal level, a structural level event that unfortunately impacts so many Black women in this country.
We carry invisible capes that we really have to learn how to take off sometimes.